Right. Good morning. My name is Espinoza Arteaga, and I'm going to talk about tracheoesophageal fistula in a newborn. Definition. Esophageal atresia tracheoesophageal fistula is a condition resulting from abnormal development before birth of the tube that carries food from the mouth to the stomach, the esophagus. During early development, the esophagus and windpipe trachea begin as a single tube that normally divides into the two adjacent passages between 4 and 8 weeks after conception. If this operation does not occur properly, this pathology is the result. Here is a picture where I can show you what does this pathology means. Applications in medicine. How is tracheoesophageal fistula treated? Surgeons at Boston Children's Hospital have developed highly successful techniques for treating TEF and recurrent TEF that do not result in further recurrence. If your baby has TEF without esophageal atresia, it can usually be repaired in the first day or two of life with one short operation. This procedure has also been successful for those children suffering from recurrent TEF. The procedure is customized to your child to ensure the best possible results. Here I have a video to explain more about the topic.
A tracheoesophageal fistula is a birth defect in which the esophagus has an abnormal connection to the trachea. The esophagus is the tube that food passes through from the mouth to the stomach, and the trachea is the windpipe that air passes through from the mouth and nose to the lungs. The trachea forms during the 6th week of pregnancy. Here, you can see the tube that will eventually form all the organs of the digestive system. The trachea and lungs grow from the part of the digestive tube that will eventually become the esophagus. For unknown reasons, the esophagus and trachea may grow and separate abnormally during this time. The esophagus may end in a blind pouch with missing gaps and be abnormally narrow. This absence or narrowing of a natural body passageway is called atresia. The esophagus and trachea may also have an abnormal connection called a tracheoesophageal fistula. Here we see the most common type of tracheoesophageal fistula in a newborn infant. The upper esophagus ends in a blind pouch, and the lower esophagus connects to the trachea. This is a serious problem because stomach contents can travel up the esophagus and pass through the fistula into the trachea and lungs. The fistula can also cause difficulty breathing for the newborn since air can now bypass the lungs and enter the stomach. Before a tracheoesophageal fistula repair procedure, an intravenous line will be started. The baby may be given antibiotics through the IV to decrease the chance of infection. The baby will be given general anesthesia, which will put the baby to sleep for the entire operation. A breathing tube will be inserted through the mouth and down the throat to help the baby breathe during the operation. The surgeon will make an incision in the baby's chest, usually on the right side. Through the incision, the surgeon will gently move the lungs aside to view the trachea and esophagus. After identifying the tracheoesophageal fistula, the surgeon will slowly close the fistula's connection to the trachea with sutures, then cut the connection away from the trachea. The fistula's connection to the esophagus will also be cut, and the fistula will be removed. Next, the surgeon will make an incision at the end of the upper esophagus to open it. Then, the upper and lower esophagus will be connected with sutures. Finally, the surgeon will insert a surgical drain in the chest and close the incision with sutures. After the procedure, the baby will continue to use the breathing tube until they've healed enough to breathe on their own. The baby will be taken to the neonatal intensive care unit for monitoring. Pain medication will be given. The baby may continue to receive antibiotics through the IV. Babies are released from the hospital when they're able to eat enough to maintain their weight, which may be after 2 weeks or longer.
So, the next thing we have is pros and cons. On the side of the pros, there isn't any pros in this condition because we're talking about a pathology. Cons, any liquid can pass through the abnormal connection between the esophagus and the trachea. When this happens, liquid gets into the baby's lungs. This causes pneumonia and other problems. Issue applied in Ecuador. As in every country in the world, there are kids born with congenital deficits, and TEF is one of them. However, it can easily be detected and surgery corrects the problem. However, some kids may have problems with swallowing in the future, but no reason for not having a normal life. There isn't data that states quantity of newborns with TEF. Conclusion. As a fetus is growing and developing on its mother uterus before birth, different organ systems are developing and maturing. The trachea and the esophagus begin developing as one single tube. At about 4 to 8 weeks after conception, a wall forms between the fetus and esophagus, and trachea separate them into two distinct tubes. If this wall does not form properly, TEF can occur. Now we'll show you a video talking about this pathology.
Okay, now we're going to talk about tracheoesophageal fistula, or TEF, and esophageal atresia, or ET. So with TEF, what it is a connection or an abnormal connection between the esophagus and the trachea. They've kind of formed together. So what you're going to see there are frothy white bubblers, because when that child is drinking formula or breast milk, because of that connection, some of it's going to get into the lungs. They're going to cough it up and spit up, and it's going to be those frothy white bubblers. Now with ET, it's when the esophagus doesn't form completely, so food doesn't reach their stomach. So when that happens, they're going to be vomiting it back up, they're going to be coughing and choking while they're feeding. So to treat these, it's just a surgical correction, but it's got to be within the first few days, because obviously this way they are not going to get the nutrition that they need to gain weight.
Now I will show you the other video.
Esophageal atresia is a congenital anomaly seen right away at birth. There are two main types of this. There are 5 types overall, but 2 main types that we see relatively commonly. One type, the most common type, is where there is a gap in the esophagus. So the esophagus is obviously the swallowing tube. When you swallow food, it goes down the esophagus into your stomach. Obviously, if there is a disconnection in the esophagus, people can't eat. The most common type of esophageal atresia is where part of the esophagus is missing, that is, there's a gap in the esophagus, and then there is an abnormal connection between the lower part of the esophagus and the trachea being the tube that brings air to the lungs. So obviously this is bad for two reasons. One, babies can't feed, and number two, there's a connection abnormally between the swallowing tube and the breathing tube, and this can lead to breathing problems as well as the eating problems, and in fact this can be a life-threatening disease. The other and slightly less common type is where there is a gap in the esophagus and there's no connection to the trachea.
Thank you very much. I hope you like my presentation.